So, our presentation is about the evolving nature of what we know and how we have refined our understanding of COVID-19. So, what is coronavirus or COVID-19? Well, basically, COVID-19 is a new disease, and our understanding of the virus that causes it continues to evolve. It was first detected in China and has now been detected in over 100 countries, including the United States. The disease is believed to have originally occurred from animal to person contact and spreads person to person. COVID-19 affects different people in different ways. Infected people have had a wide range of symptoms reported, from mild symptoms to severe illness, including death. Okay, and next up is a diagram of the virus itself, and I'm just going to kind of go over the different components that make up the virus. Um, so basically, cells are carefully constructed and have, among other things, evolved to control the transport of water, ions, nutrients, and any other materials that may want to gain entry. To find a way into a virus, they must have a structure with characteristics that bypass millions of years of evolution. The host must be tricked into replicating the virus and hijacking the manufacturing capabilities of the cell itself. This will also require bringing along all the other tools necessary for making the new cell a new home for that virus. The various components listed here accomplish all the critical tasks. The spike attaches the virus to the host cell. The M tricks the cell into incorporating the RNA of the virus into its own manufacturing process. And the other components listed create a structure that protects the virus along the way, ensuring it can deliver on its ultimate goal, which would be survive long enough to be replicated and expand its domain to infect other cells and other organisms. Coronavirus origination. SARS-CoV-2 is not a laboratory construct and was in fact spread through an animal. SARS-CoV-1 was first identified back in 2003, relating to other coronaviruses isolated from bats with more than 8,000 cases. Many coronaviruses can also infect other animal species. Symptoms of SARS-CoV-2 were first identified in early December 2019 in Wuhan, China, as well as the first confirmed case. Many people who were first infected were either stall owners, market employees, or regular visitors to a wholesale market in Wuhan. The market was then closed on January 1st, 2020, due to positive test results tracing back to market relations. Evolutionary origins of SARS-CoV-2, also known as COVID-19. Coronaviruses can infect amphibians, birds, mammals, and humans. In December 2019, China led local health officials to issue an alert to the Chinese Center for Disease Control and also the World Health Organization's China Country Office. In early January, the coronavirus was officially named SARS-CoV-2 by an international committee on taxonomy of viruses. By mid-January 2020, the virus was spreading widely within Hubei province. By early March, SARS-CoV-2 was declared a pandemic.
A timeline overview of COVID-19 in the year 2020. January 21st, United States confirms its first case in Washington State, a man who traveled to the Wuhan area. February 29th, the United States reports its first death, a man in his 50s with an underlying health condition. May 23rd through the 30th, U.S. deaths pass 100,000 cases. August 10th through the 17th, Russia approves vaccine. Moderna agrees to supply the United States vaccine. January 22nd through the 29th of 2021, U.S. COVID-19 cases declined by 19%. How does COVID-19 affect the body? Viruses work by hijacking cells. They enter host cells and reproduce, then spread to new cells throughout the body. As pathogens that the body does not recognize, viruses trigger an immune response. This can cause inflammation and other effects. Coronaviruses spread among people through droplets from coughs, sneezes, or breathing. Once inside the body, coronaviruses mostly affect the respiratory system, including the nose and lungs. Common symptoms of COVID-19. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Unusual symptoms of COVID-19 are gastrointestinal symptoms, loss of smell or taste, skin changes, confusion, and eye problems.
Personal protective equipment. At the beginning of the pandemic, medical experts lacked efficient evidence on how SARS-CoV-2 spreads, and they didn't know enough to make strong public health recommendations about masks. The standard mask for use in healthcare settings is the N95 respirator, which is designed to protect the wearer by filtering out 95% of airborne particles that measure 0.3 micrometers and larger. As the pandemic ramped up, these respirators quickly fell into short supply. That raised the now continuous question, should members of the public bother wearing basic surgical or cloth masks? And next, we have a few stories about different experiences with masks. Science alongside recent studies suggests that wearing a mask could save lives in different ways. Research shows that wearing a mask will cut down the chances of both transmitting and catching the coronavirus. Some studies hint that masks might reduce the severity of infection if people do contract the disease. Confidence in masks grew in June when news about two hairstylists in Missouri who tested positive for COVID-19. They both wore masks while working, and although they passed on the virus to members of their household, their clients seem to have been spared. Other hints of effectiveness emerged from mass gatherings. At Black Lives Matter protests in U.S. cities, most attendees wore masks. The events did not seem to trigger spikes in infections. However, the virus ran rampant in late June at a Georgia summer camp, where most children who attended were not required to wear face coverings. What leaders and doctors are saying about COVID-19 and how to prevent it. According to the World Health Organization in March 2020, in an analysis of 75,465 COVID-19 cases in China, airborne transmission was not reported. Here's what we know now. In October, the CDC acknowledged another way that COVID-19 spreads. It's through airborne transmission. While some things have changed as far as guidelines go, these will always remain the same. Wear a mask, social distance, wash your hands, and avoid gatherings. The dangers of community spread. SARS-CoV-2 is still a very serious virus, and COVID-19 is still a very serious disease. Though most of those infected will recover without hospitalization, the virus is easily spread. Even if the death rate is only 1%, the number of lives lost will be substantial. Here's a quote by Jason Kessler. You take a small percentage of a big number, you're going to get a big number. I think people really do need to take this virus very, very seriously and continue to take it seriously.
Here are some recommended ways for us to help prevent the spread of the virus. The changing nature of the COVID-19 response. One thing that we say today may not necessarily hold true tomorrow, as the science changes as the truth comes to light. Dr. Jason Kessler, infectious disease expert. For example, there is growing evidence that mask wearing by the public helps reduce the spread of coronavirus, he explained. Overall, the public health messages from early on in the pandemic are still critically important to prevent and lessen the spread and impact of COVID-19. Keep social distancing in place, whether you're indoors or outdoors. Wash your hands regularly. Keep very close attention to your cough hygiene and cough or sneeze into your sleeve or a tissue. Now, wearing masks or facial coverings will join that list. Evolving treatment. Techniques for care have changed dramatically. Even over the course of the last 12 weeks, proning, for example, which is a process of strategically turning a patient onto their stomach, and medical guidance involving mechanical ventilator use for critically ill patients have evolved. The medications used to treat COVID-19 have also changed quite dramatically. COVID-19 vaccine. Vaccines normally take about 10 to 15 years to develop, but because cases were becoming so severe so quickly, immense pressure was being put on the healthcare system to speed up the process. Based on CDC.gov, there are 2 authorized and recommended vaccines as of January 4th, 2021. Pfizer BioNTech and Moderna. Johnson & Johnson have just submitted their application to the FDA for an emergency use authorization to use their single-shot Janssen COVID-19 vaccine. According to the Johnson & Johnson website, they expect to supply 100 million doses to the U.S. in the first half of 2021. What we know about coronavirus. 3 things that have changed. Since that first confirmed case in January 2020, many of the assumptions about COVID-19 have been confirmed by the scientists studying the virus, but other assumptions have not panned out. First, what we thought, those most likely to die from complications of COVID-19 virus are older and or have chronic medical conditions. What we've now learned, older patients tend to have a worse outcome if they are infected with the virus. It took longer to understand that younger adults are also being infected, and the number of those infections is not insignificant. Jean Laurent Casanova is compiling information from around the world on young people who have developed a COVID-19 infection that is serious enough to get them admitted to intensive care. What we thought, you had to have symptoms of the virus to be able to transmit the virus. What we've now learned, COVID-19 studies are showing that people appear to be able to spread the virus when they are pre-symptomatic. According to a story on Stat News, Gabriel Leung, Dean of Medicine at the University of Hong Kong, has estimated that about 40% of COVID-19 cases transmit before symptoms develop.
So we originally thought that there was no benefit in wearing surgical or other protective masks for people who are not sick with COVID-19. We now learned through the Centers for Disease Control and Prevention that covering your face is an excellent way to help stop the spread of COVID-19 as well as prevent receiving the virus. Towards the start of COVID-19, it wasn't recommended to wear face masks if you weren't sick. And it was also thought that healthy people do not need to wear masks and only sick people do to stop the spread of the virus. A pandemic response plan was actually put into place, and according to the plan, everyone, including people without symptoms, should be encouraged to wear non-medical fabric face masks while in public. And lastly, we have a video explaining what we currently know about the virus and how it is spreading.
In December 2019, China notified the World Health Organization of several cases of human respiratory illness, a disease later named COVID-19. The virus causing this disease is known as severe acute respiratory syndrome coronavirus 2. The disease spreads through small droplets that are expelled from the nose or mouth when a person with COVID-19 coughs or exhales. Therefore, standing close to someone who is infected can put you at risk. These droplets can land on your hand and be transmitted through something as simple as a handshake if afterwards you touch your eyes, nose, or mouth, the so-called T-zone. The virus is known to survive on different types of surfaces, so touching these contaminated surfaces and then touching your T-zone brings a high risk of infection. What we know so far, the coronavirus is spherical in shape, and its genetic material is encapsulated by different types of proteins. Some of the key structural ones are spike S protein, the most prominent feature of coronaviruses from where they get their name, then M, or membrane protein, and the so-called envelope protein.
Here we have some of our citations we use throughout our presentation. And then lastly here we have everybody who was a part of this presentation, everyone who worked on it. And that is going to go ahead and conclude our presentation.